Hi there, Elmarie again. Yes, so 12 June arrives, the day I've been waiting for. My friend fetches me again and takes me to hospital. I say again because yes, I was there a week before. Most embarrassing experience in my life, but I share the detail with you in another video. Please have a look at that one. Arrive at the hospital, the check-in goes smoothly, they take me through to the ward. There everything goes very quickly because by then I knew what to expect. The physiotherapist came around, checked on me, asked me would I like her to go through the exercises again. I said no, I'm fine, I can still remember from the week before. And very soon after that they pushed my bed up to the pre-theatre ward. So I'm lying there, it's pretty cool in there already. And the next minute a very kind gentleman comes, he opens an interesting looking cupboard there in the corner and he brings a nice and warm blanket that he puts over me. Because yes, I was getting a bit cold there, so this lovely warm blanket over me. The theatre jacket is pretty thin, it doesn't keep you warm. Then the anaesthetist comes out, very friendly as always. He asks me would I want him to go through the whole process again. I said, no doctor, thank you so much. I still remember from the week before everything you shared with me, but he just went through, first I'll get the spinal, which I agreed to and signed for. Then after that they give you sort of a relaxing medication. Then comes the general anesthetic, and once you're asleep he'll give me a heat block to ensure that I don't have that much pain afterwards. So the next minute they move me into theatre where it's very cold. Now this time it's very cold. I move onto the theatre table. Of course they assist me, I get onto the theatre table, very cold now. They put a sheet over me and give me a pillow that I will have to rest on when the doctor does the spinal. And the next minute, a gentleman there in theatre, I didn't even see the pipe, but he puts this pipe under the sheet onto my tummy, nice warm air. They are so kind. And I suppose so want to see that the patient doesn't start shivering and shaking and all that. They all in this very cold theatre and I've got this lovely warm air. So then we had to take a photograph first. I'll show you the photograph. Yes, the most amazing team. And then things moved very fast after the photo was taken. The anaesthetist asked me to bend over the pillow that I was holding on my lap, and he said I already cleaned my back and said, are you ready? I'm going to do the spinal now, which he did. Then the relaxing agent was, of course they put a drip into my arm, so the relaxing agent was put into that drip. I mean, I was very relaxed in any case. I was looking forward to the surgery. Then followed the general anesthetic. Just quickly a mask over my face, and I love that feeling when you just feel there, you're fading and you're gone. And it happens within seconds. And then, I didn't know about it, of course, I believe I got the hip block. The next thing I knew of was when I woke up outside theatre again, just outside theatre. We were lying there sort of waiting to wake up. The anaesthetist came and just patted me on my shoulder and said everything went very well. They then moved me down to ICU where I spent the night and slept very well. I slept so well, no pain, no nothing. And very early the next morning, of course, right through the night, the nursing staff would come and check and take blood pressure, but I didn't even notice that. All very professional, very kind, very friendly, very helpful. Very early the next morning, the physiotherapist was there and she said, come, you need to get up. You need to go and brush your teeth. I said, what? I need to get up. She says, yes, your crutches, on both your crutches. totally different from the previous round in 2016, where I wasn't allowed to walk. So I got up and I still did not feel any pain. I've never felt pain with this right hip replacement. So I walked to the wash basin, which was about a meter away from my bed, started brushing my teeth, and of course there were two nursing sisters and the physiotherapist standing with me, but I was absolutely fine. Then walks in my surgeon, he says, "Come, let's see." Back to the bed, "I want to see that wound." And I just said, "Doctor, you are absolutely amazing." I mean, that is the next day, it's a couple of hours after this huge surgery, and I feel on top of the world. I have no pain at all. He just looked at me. Then I had to go back and sit on the bed, and he had a look at my wound and the drainage, etc. And he said he's absolutely happy. I can go to the general ward. So they packed my things after I brushed my teeth, and I went to the general ward. There, we were only two in the ward, and there was a lady next to me, same age as me, and of course we got chatting. She had a knee surgery done. Apparently she's had many surgeries, and she was in so much pain. And I felt bad because she asked me, how's my pain? And I said, I have to be honest, I do not feel a thing, nothing. But I do understand there's still medication coming through the drip, so I take it as that. She says, but she also has that. Why does she have so much pain? And I said, I tried to play it down because I really did not have any pain. So we got talking, and she told me about all her surgeries and all her issues, and I just thought, I am so grateful for my health. She then came up with a theory, and I think it makes sense. She says she's constantly on painkillers, and then with a certain painkiller it gets to the point where it's not enough anymore. Your body gets used to it, and then you feel the pain again. And she said, maybe because I never take painkillers, I'm not one for pills. If I have to take medication, I'll do that. She says she just thinks my system is so not used to any medication that this painkillers that they're giving me through the drip really work. Because I was just happy and ecstatic, and slept one night in the general ward, and the following morning I could go home. So I slept in hospital 2 nights, one in ICU and one in the general ward. I was fetched, of course in a wheelchair, could use my crutches when I got home, and I climbed the stairs when I got home very carefully, because my surgeon just kept stressing, don't let that implant slip. That is the most important thing. So I climbed the stairs very slowly and carefully, came into my little place. I thanked the person that dropped me off, got ready, and went to bed. So that is the surgery itself. Absolutely amazing experience. Really life-changing. Best surgeon in the world. In the next video, I'll share with you my first 2 weeks at home. It was good talking to you, and we'll chat again. Bye-bye.